Hi, everyone. Welcome to our Cecilia Health webinar. I'm Emily. I'm one of the dietitians and diabetes educators. And today we will be talking about Diabetes 101, Mastering the Essentials. Here at the very bottom, you will see a phone number, 1-800-263-6317. If you're having any difficulties, please reach out to that phone number. Next, oh, wonderful. Thank you. So this is an interactive program. The idea is that our presenter, Sally Kate, will have a short presentation, but there is time at the end to have more of a discussion, more of a Q&A. You will see in your toolbar section, there is a questions tab. So please feel free at any point to enter any questions that you may have throughout our webinar, and she will discuss those at the end. And just as a disclaimer, we know that the information you are about to hear may motivate you to make some changes, but please do talk to your doctor before making any changes to your current routine. The Cecilia Health Certified Diabetes Care and Education Specialist will provide strategies to help you manage your diabetes, and this online Q&A session is intended to give general advice. It's not meant to substitute for personal medical advice and involves the professional opinion of the Cecilia Health Certified Diabetes Care and Education Specialist. So our leader today, our webinar leader, is Sally Kate Collins. She is a registered dietitian as well as a certified diabetes care and education specialist. She has experience working with patients who have diabetes, high blood pressure, weight loss, and chronic kidney disease for the past 9 years. She lives in Mississippi with her family, and in her free time, she enjoys spending time with her kids, cheering on Ole Miss sports, volunteering, and traveling as well. So thank you all again for joining us today. And Sally Kate, I'll pass it off to you. Thank you.
Thanks, Emily. I am so excited to be with y'all today. So I am very passionate about diabetes. So I'm really excited about talking just about the basics today. Our discussion is going to include what is diabetes, what is included with a diabetes diagnosis, like what labs you can look for that would help you determine when you're diagnosed with diabetes. We're going to talk about blood sugar monitoring as well as medications that can help control your blood sugars. We'll discuss complications that you may want to be aware of and how you can prevent them. What to eat, which would just include a basic diabetes eating pattern, and then we'll go over just questions that you may have as well. And of course, please talk to your healthcare provider before making any changes with your diabetes treatment plan. And then after our presentation, we're going to have plenty of time at the end for sharing and discussion if you have any questions too. All right, so what is diabetes? There's a few different types of diabetes, but there's going to be type 1 diabetes is an autoimmune disease, and that is when your body produces no insulin. And then type 2, which is the more common form, that really starts as insulin resistance, meaning your body doesn't use insulin properly. Insulin is a hormone that's produced by your pancreas that moves sugar from your bloodstream into your cells, where that sugar is then used for energy. And when your pancreas is going to make extra insulin when your body doesn't use that insulin properly, but eventually it just can't keep up. And then that glucose builds up in your blood instead of going into your cells. And your cells sense that they are starving for energy because they're not getting access to that glucose. Your body may have it in it. Your body's going to have that glucose in it, but the cells aren't able to access it. This can be treated with lifestyle changes, medications, both oral and injectables, and insulin. So when we're talking about a diagnosis of diabetes, on this slide, you see 3 different ways that you could be diagnosed, different labs that you could see that your doctor may give you. A1C, so the normal range is under 5.7. If you are in this maroon stripe there, that is considered pre-diabetes, and that's an A1C between 5.7 and 6.5. And if you have an A1C over 6.5, then that's when you would be diagnosed with diabetes. These numbers are set by the American Diabetes Association. The FPG, that is an abbreviation for fasting plasma glucose. And with that, if your blood sugar is within normal limits, it is under 100. anywhere between 100 and 126, and this is fasting. This is before you've eaten anything in the morning, or before you've gotten to the lab to have your blood drawn. If it's between 100 and 126, that is considered prediabetes, and then over 126 would be a diagnosis of diabetes. An OGTT, that stands for oral glucose tolerance test. That would be a test where you may go to the lab and they may give you some glucose. This is not like you've eaten something at home, because that's not going to be a controlled amount of glucose. This is going to be a set amount that the lab gives you, and when they check your blood sugar after you've had that set amount of glucose, if your blood sugar is under 140, that's normal. If it's between 140 and 200, that's pre-diabetes, and above 200 is considered diabetes. Now, just to give you a little bit more idea of what an A1C is, that gives us the picture of your average blood glucose or blood sugar, how it's been controlled over the past 2 to 3 months. Hemoglobin is a protein that links up with the sugars in your bloodstream, like the blood glucose, and it's found inside your red blood cells. Its job is to carry oxygen from your lungs to all the cells of your body. And whenever glucose enters your red blood cells, it links up with that hemoglobin protein. And so we're able to see how much of that hemoglobin has been linked up with glucose. So the more glucose that's in your blood, the more of that protein gets glycated. And so we're going to be able to measure the percentage of how much of that hemoglobin has been glycated. It's a percentage in your blood, and we get to it gives us an overview of what your average blood glucose control has been for the last couple of months. Typically, your doctor is going to be measuring it at least twice a year. And that's going to, like I said, it represents an average of your blood sugars level 24 hours a day. So it looks at what your blood sugar is when it's high after you've eaten a meal, also when it's low, when you haven't eaten anything and maybe it's fasting in the morning. Then your self-monitoring of blood glucose, that measures what your blood sugar is at just a moment of time. So that's like if you're pricking your finger, that gives us what your blood sugar is right now, whereas our A1C tells us what our blood sugar is over a period of time. Some of the benefits of checking your blood sugar, of the self-monitoring of your blood glucose, that gives us a good picture of your body's response to your diabetes care plan, especially keeping your blood sugar in a normal range, and we'll talk about that here shortly. That can help prevent and delay those complications that we get concerned about. It's especially important to monitor if you are taking insulin, if you're having a hard time controlling your blood sugars, if you have low blood sugars, especially if you have them without having those usual warning signs of having a low blood sugar, like kind of feeling jittery, cold sweats, not feeling ill.
Sally, Kate, are you there? We lost the sound for just a second.
To make sure that you don't have any like
Oh, I hear you now. Perfect.
Okay, perfect. You want to wash your hands before testing. You want to make sure that you're getting any residual, like you don't have any sugar on your hands from any snacks you may have had. You want to insert your test strip into your glucometer, that's the fancy word for a blood sugar meter, a glucometer. So you insert your test strip. You're going to use the lancing device on the side of your fingertip when you poke your finger, and that just helps. You're able to not have to go quite as deep as if you're having to poke your finger on the tip of your finger when you do this, use the side, but you're usually able to get just the same amount of blood, so it just doesn't hurt quite as bad. Then you're going to touch that drip of blood on your strip. Then your blood sugar level is going to appear on your meter's display. Sometimes that you would want to like, when do I check my blood sugar? I prefer when my patients are checking it fasting. If they're not checking at all, that's a good time to start, because that gives us an idea of consistently what your blood sugar is doing in the morning, and it kind of gives us an idea of overall how well your blood sugar is controlled. So fasting blood sugars, that's usually in the morning before you've had breakfast, before you had coffee. Other times you could check is before a meal and then 2 hours after the start of a meal. When you check your blood sugar like that, that gives us a good idea of what the amount of carbs you ate, how much of an impact that had on your blood sugar. Because we can see, all right, before I've eaten anything, this is what my blood sugar is. And then after I'm done, how did my blood sugar respond to that? And you can always ask your healthcare provider when and how often is going to be the right plan for you. Target ranges of blood sugars are American Diabetes Association sets anywhere between 80 and 130 before meals. So that's that fasting number. We want it to be between 80 and 130. Then if we're checking our blood sugar 1 to 2 hours after the start of a meal, we want it to be below 180. Now, your doctor may have a different target for you, so it's always a good idea to talk to them about what your personal targets are, because those can be individualized based on how long you've had diabetes, your age, if you have any other medical conditions, if there's any known cardiovascular disease, if you have hypoglycemia unawareness, or if you have any there are other reasons why they may have different considerations as well for what your targets are and how often they want you to be checking your blood sugar. It's always a good idea when you're checking your blood sugar to keep a log so that you can share that with your doctor and you can kind of go over what is working with your diabetes care plan. On your log, you're going to kind of keep up with the date and time and your result. If you've eaten anything, like if it's fasting or not, is also a helpful thing to keep up with. But you can keep that in your notes. So if you've eaten a meal, if you're checking it before and after a meal, keeping up with what you ate, that can be helpful. If you've exercised, how you're feeling. There's a couple of apps too that you may want to download on your phone. There's always an app for that, right? But you can download a couple of different apps on your phone that can help keep up with that so that you're not having to have a paper log that you're keeping up with when you go into the doctor as well. So let's say you start you're checking your blood sugars and you have noticed sometimes when I feel shaky and I check my blood sugar, I'm having a low blood sugar. And what I'm considering a low is something 70 or below. Okay. You're going to want to follow the rule of 15. With that, you're going to, let's say I check my blood sugar, it's below 70. You're going to want to eat or drink 15 grams of carbs, wait 15 minutes, and then then check your blood sugar again. Now, is it less than 70 at this point? If so, you repeat it. This helps you limit overcorrecting from a low blood sugar. 15 grams of fast-acting carbs may be a half a cup of fruit juice. Maybe it's a half of a can of regular soda. 8 gummy bears are lifesavers, or a tablespoon of jelly. I think that the tablespoon of jelly is a great option because a lot of times when you have issues with your blood sugars, you don't necessarily have fruit juice or regular soda handy, and because you're typically not supposed to be having those things. To help control to keep your blood sugar in a normal range, but those are things that are so you may not always have it handy, but a tablespoon of jelly will do the trick just the same. So as far as medications that you can take that your doctor may prescribe to help you with controlling your blood sugars, they may have, no matter what you're changing with your lifestyle, your body just may need a little bit extra help. And that may be adding oral medications like pills, injectable medications, or insulin as well. Insulin is just a naturally occurring hormone. It's secreted by your pancreas. With type 1 diabetes, like I mentioned earlier, your bodies don't produce enough insulin, but with type 2, your body doesn't use your insulin properly. So it may be something where you need to take additional insulin to help your body control your blood sugars a little bit better. There's more than 20 different types of insulin sold in the United States today. In addition to other things that you can, besides insulin, you can also have injectable medications, and those will affect your body's hormones to help lower your blood sugar. And there's also oral therapy options as well if you feel a little anxious about having injectables that may be right for you as well. And that's typically, it's going to be only for people with type 2 diabetes, the oral therapy options are. They work best when used with diet and exercise as well. They're usually most helpful when you're newly diagnosed. There's not necessarily
Sally, Kate, are you still there?
With your doctor as
Oh,
far as what your options are. Yep. Sorry,
I
Emily,
hear
can you
you
hear
now.
me?
No, I hear you now. I hear you.
Just coming in and out. I'm so sorry about that, guys. All right. And then complications. So the first thing, the microvascular, micro meaning small, these are going to be where when you have very teeny tiny blood vessels in your body, they are going to be impacted by having high blood sugar for extended periods of time. So in your eyes have tiny blood vessels, and that's called retinopathy if you have damage to those blood vessels. Then your kidneys, and that's called nephropathy, as well as your nerves, and that's neuropathy. You can also have macrovascular complications, and those are places where you have large blood vessels in your body. That can include cardiovascular disease and stroke. Other complications that you can have, you'll be more at risk for when you have diabetes are depression, some skin disease, as well as gum disease. So how can you prevent that? Controlling your blood sugar, being aware of what your blood sugar is by having your A1C checked every 3 to 6 months. Our goal is going to be under 7 for most people. Having regular checkups with your diabetes doctor every 3 to 6 months. When you go to those checkups, they should be checking your feet, your blood pressure, your weight. Having an annual dilated eye exam will help to check to see if there's been any changes in your vision, and they can check to see if you have retinopathy. Other things that you can do from a personal standpoint: stop smoking, controlling your cholesterol, which may be with medication, could also be with diet and exercise, as well as controlling your blood pressure. So now this is the thing that most people want to know from what can I be changing up is what can I eat? So it's the carbohydrate that's going to count here. Trying to have consistent carbs at meals and snacks will be helpful. The amount of carbs that you're going to need per meal is going to vary with each individual. So I always like to suggest that you meet with a dietitian when you have diabetes just to kind of get the basics down. You can go to the www.eatright.org website and enter your zip code to find a dietitian in your area. But a good place to start is with the plate method. So you can see here in this picture what the plate method looks like is where you're having a 9-inch round plate. You split it in half and you fill up half your plate with non-starchy vegetables. Those may include salad, cabbage, Brussels sprouts, broccoli, carrots, cauliflower, asparagus, summer squash, tomatoes. Those are all non-starchy vegetables. And then you split the other half of your plate with and you're going to have a quarter of your plate being the protein you're going to have. So maybe it's baked chicken, fish, and then the other quarter of your plate you're going to have is going to be a whole grain or a starchy vegetable. So that might be pinto beans, brown rice, whole grain pasta, corn, potatoes, whatever kind of carb you're going to want to have, limiting that to a quarter of your plate. You can always also go to the diabetes.org website, which is the website for the American Diabetes Association, and they have a fantastic food and fitness section. They have recipes you could try, as well as additional resources you can use to look at if you're interested in counting carbohydrates or just looking into this a little bit further. All right, well, that is all of the slides we have for today. Does anyone have any questions? Don't see any. So while y'all, if you're thinking of them, one of the questions I get often is like, okay, do I need to cut out all of my carbs? No, we definitely don't want to do that because our bodies still need that carbohydrates for energy in our body. We want to be aware of how much we're going to have. So being mindful of your portion size and what that portion size looks like for you may be different than it looks like for someone else. Another question that anxiety, rather, may be the right word, that people have when they're going through their journey with having diabetes is, they get nervous about taking insulin, and I've known someone that's passed out from insulin. Will I be passing out? Was that something I need to be worried about? When you're taking insulin, I've had patients who, prior to being on insulin, their blood sugar was very out of control, and when they started insulin, their blood sugar got under control, and they didn't care what it was. They felt so much better. The way they felt definitely overcame any anxiety they had once they realized how much better they felt. When when your blood sugar's out of control, or is not where it needs to be, you feel poorly, and sometimes it happens so slowly you don't necessarily notice it as well. But with taking insulin, as long as your blood sugar is within a normal range, certainly you can be more prone to having low blood sugars, but following that rule of 15 we talked about, that can help as well, so that you're not having these low blood sugar moments that may cause you to feel poorly and having any additional like syncope or anything. But what you'll do with that is you just have, if your blood sugar is under 70, you would treat it like you normally do, having 15 grams of carbohydrates, wait 15 minutes. And then if your blood sugar is not over 70, then you would just repeat that again.
Well, thank you so much, Sally Kate, for presenting today and for answering our questions. Just so
Yeah.
everyone knows, if there was a particular topic that Sally Kate mentioned that you want to learn more about, we do offer other webinars that focus on each one of these topics individually as well. Here in November, we do have our holiday eating webinar, so please check that out. And then in December is all about tips and tricks for helping to take control of your diabetes as well. Again, if you have any extra questions, your diabetes educator or your health coach can help direct you as well. Also, we have a Facebook page if you want to find more information there as well. But thank you all again for participating today. We really appreciate you joining us. So thank you again. Have a great day. Bye-bye.
Have a great day. Bye bye.